Go ahead, Brian.
Good evening, Mono County, and thank you for joining us for this emergency session of our community conversation. My name is Brian Wheeler, and I'm the Public Health Director for Mono County Public Health. Sadly, we are back here for a meeting to discuss the critical situation we find ourselves in, and it is quickly evolving. And we are pretty close, if not at a crisis point. The Delta variant is rapidly spreading through Mono County, wreaking havoc. And we will briefly get into the numbers in just a little bit and give some explanations about what we're seeing. But I want to pose a question. Do you care about your community? Do you care about your neighbors? If so, please, please wear a mask, get vaccinated, get tested. We are seeing astronomical number of cases we cannot even follow up on in a timely manner at this point. It has happened so rapidly. Just a few weeks ago, I think 4, and Emily can correct me, our epidemiologist, we were at a case count of 0. Today, it's probably over 30, and then just in a few weeks. So again, I'm joined by members of officials from the town of Mammoth Lakes, Mono County, Mammoth Hospital, and a few other individuals as well. And again, please, please get vaccinated. Please wear a mask. Please take care of yourselves and each other. Stu, go ahead.
Thank you, Brian. With that, we'll kind of just begin with our usual presentation. We just want to walk you through what we're seeing in the community, what the state has been enacting, and then where we are in the county with our masking ordinance. We'll kind of wrap up with some vaccination dates and also some testing information. And then we'll open it up to our questions. So we'll kind of get going here. Again, just want to start the conversation welcoming our Spanish speakers. So all this information here, easy to follow. And we have our public health Latino outreach coordinators available to you. And you can see you have Juan and Maria, there's their contact details. But again, just follow the instructions on the slide to listen in the Spanish option. So we're going to we always start the presentation with our metrics, kind of gives us a baseline of where we're at. You can kind of see here, as Brian kind of indicated, the case rate is dramatically climbing and it's changing each and every day. So with the kind of increasing change in our transmission rates and details, we've asked our epidemiologist, Emily Janoff, to join us, and she's just going to kind of walk us through these numbers on the next couple of slides. Emily.
Thanks, Tim. Hi, everyone. Thanks for being here with us this evening. So yeah, as we mentioned, you've seen this before, positive cases in the county, and actually as of a couple hours ago, we are now over 1,100. We're up to 1,111 cases total. That was a jump that just happened about an hour ago when we got a big batch of results in. So that percent increase is probably no longer valid either. Go ahead to the next slide, please. Again, some stuff that should look familiar to you. Just a note, so we do run a lot of this on a lag, typically about 10 days or so. That's just how long it takes to get a good idea of what a week looked like in terms of COVID in the community. So you'll see this is current through the 24th of July, and that was the last full reporting period that we worked with. We were up to a case rate of 15.3. If you're looking into the week after that, ending on July 31st, then you're looking at about I think we're at 14.3. I do anticipate that to rise a little bit as some more cases fall in. That just happens as we do our contact tracing and our case investigations. That will climb a little bit. And then this current week that we're in, we've had 37 new cases since Monday. So we're looking at a much higher rate than that, more than doubled probably. So, and then below that positivity rate, again, we've been working with this through most of the pandemic. So we landed at the 24th, we had 6.3%. The most recent number I saw that came from the state for us was 7.5. So we're encroaching on that 8% threshold that we've kind of tried to stay below throughout most of this. Go ahead to the next slide, please. So again, you see this here. So this is based on CDC recommendations for areas based on what their transmission level is. So we are over that daily case rate there in that high transmission category. And we are approaching that test positivity. Although, like I said, the last number I saw was 7.5%, but that runs on quite a bit of a lag, almost 2 weeks. Just for reference, we locally OptumServe yesterday did 59 tests. We've already gotten 28 positives back out of that, which is about 50%. And there's still some pending, and that doesn't include some county testing that we did. So we're seeing really high percentage rates in that category. Let's see, go ahead to the next slide, please.
Emily, can I add something to that before you move on?
Please.
So can you go back? So I want to emphasize for everybody, this is a CDC recommendation. This is across the country and not just California, and certainly not just Mono County. But if you look at the what's circled under high transmission, where it says mask required, both unvaccinated and fully vaccinated, and I'm going to say this because it bears repeating and you're going to hear it again, this is now a strain that you can transmit whether you're vaccinated or not, which is why the recommendation is you wear a mask whether you're vaccinated or you're unvaccinated. The advantage of being vaccinated, as we will, again, probably say multiple times tonight, is that drastically reduces your chances of getting hospitalized or dying from this virus. But the ability to transmit it to other people is very real and very different than what we first saw and what we believe to be true with the original strain, which is why we relaxed the mandate on masking a few months ago.
Thank you, Craig. Just want to touch on a couple other points here before I pass it back. So breakthrough cases. I know there's been a lot of buzz around this in the media, and I'm sure everyone's been hearing. So by definition, a breakthrough case is a positive COVID case in an individual that was fully vaccinated. When this slide was put together about 2 days ago, we'd had 16 in the county. That number's up to 33 as of right now. But the points still remain. So they are happening. And when I combed through this data, there was about 80% of these were asymptomatic or extremely mild cases. As Craig said, this, once you're infected, even if you're vaccinated, you can still transmit, but the chance of you getting infected if you're vaccinated is still very much lower. If you're looking at total vaccinated individuals in the county, even with that 33 number that we're at right now, it's less than 1%. So not huge numbers of these breakthrough cases happening. And just to reiterate, none of them have been considered severe cases or required any hospitalization. And I did want to just touch on some CICT stuff. So this is case investigation and contact tracing. In my reporting on the aggregate CICT data for the county, we've noticed a sharp decline in cooperation with our investigators. People are just less willing to provide information on their contacts, workplace exposures, or even complete the interview at all. I just would like to reiterate that we are not associated with any law enforcement or immigration entities. We're just urging you to keep in mind that the only goal with our contact tracing efforts is to control the spread of the virus in the community. And our ability to do that hinges on the information that we are provided. There's resources available for individuals that are instructed to quarantine or isolate. So going forward, you know, everyone's cooperation is going to be much appreciated, especially going into this new surge. You know, we kind of trimmed back a lot of our staff when everything slowed down over the summer, and we're looking at case numbers now that are going to be really hard for our team to get through in terms of tracing efforts. So just work with us, and yeah, I think that's about all that I got. I got a note here. We do want to mention also, you know, there's with the clusters that we're seeing, there's going to be a need for testing. There's going to be increased testing around the county. There's going to be exposures, and We do like to point out that the testing is not the same exact testing that it was in the beginning of the pandemic, where they swab all the way up into your brain and it was extremely uncomfortable. It is a nares swab now, and it goes up about 1 inch into your nose. And so if that is something that is holding you back from going to get tested, that should not be a concern. And we should be seeing some increased testing efforts around the county. And I think I'm going to pass it back from there.
Thank you, Emily. That was fantastic. I think you've got yourself a regular slot on our panel. We're just going to walk through a couple of slides. We have referenced the CDC, and we also kind of follow our state guidelines as well. These were updated just recently, July 28th, last week. And these were the kind of the recommendations from the CDC for fully vaccinated people to wear a mask in indoor public settings in those areas of substantial or high transmission, which is what we've really talked about and where we are in Mono County. Also a recommendation there for fully vaccinated people who have a known exposure to be tested 3 to 5 days after exposure. And then the CDC recommended at that time universal indoor masking for all teachers, staff, students, and visitors to school, regardless of vaccination status. So they were kind of encompassing those recommendations on July 28th from the CDC.
Stu?
Yes.
Can I quick chime in with something related to if you're exposed? If you are exposed to someone, there is an incubation period before you should test. We've had people coming to us saying, I was exposed to someone positive yesterday, I need a test. It doesn't, the virus doesn't replicate that quickly, and there's a 3 to 5 day incubation period. So we recommend that if you are exposed, you wait till at least 3 to 5 days before you would actually get a test.
Thank you, Brian. I'm going to just pause a little bit to make sure our translators can keep up.
Oh my God, I forgot they're there.
So we'll just kind of jump into CDPH, which is the California Department of Public Health. And these were kind of not recommendations, these were requirements for masking, regardless of vaccination status. So again, this was published on July 28th, and this was stating that masks, regardless of vaccination status, would be required in all these kind of categories here, in all these industries. So you can see on public transit, you can see the many examples, and that would include kind of our Este buses, the town trolley, and so forth. They would be required. You can see masks are required indoors in our schools and childcare settings, our emergency shelters, cooling centers, and then again in our healthcare settings. Dr. Burrows wants to talk about this a little bit more, but in every healthcare setting across the state, masks are required for everybody, regardless of vaccination status. And you can see in state and local correctional facilities, homeless shelters, and then long-term care settings and adult and senior care facilities.
Stu, I hate to interrupt you again. We kind of have an update, Emily.
We just received 11 more cases in from a batch that we were waiting on. So we are up to 35 new cases today alone, close to 50 for the week since Monday. And with that good news, I will pass it back.
So I think that leads into this slide very well, Emily, Brian. Brian, if you want to just kind of walk through this slide a little bit and kind of talk about why we're seeing those many cases. We didn't see, I don't believe, these staggering amounts of cases each day with the alpha strain and those other previous variants. So why are we really seeing that now? And why is the Delta variant so transmissible?
Yeah, so the Delta variant has a mutation on the protein spike that attaches to the ACE2 inhibitor on the receptor cell or on the host cell. To get beyond that technical mumbo jumbo that no one just understood, this virus is very transmissible. It is one of the most transmissible viruses currently known. Every person that gets infected whether vaccinated or not, will transmit this virus to 5 to 9 people. So if you do that math over a couple generations, you're going to see exactly what we're seeing here today in our case counts that are coming in. So as I mentioned back a few weeks ago, I think it was the week of 6/20, we were at 0. And now we're at, 50 plus cases for the week, and the week's not over. There's still more testing. So, this virus is just very, very transmissible. It doesn't care if you're vaccinated. If you're vaccinated and you get the strain, you have the same amount of virus in your nose and throat as someone who is unvaccinated. The bright part of it is that if you're vaccinated, you're not, as Dr. Burrows highlighted earlier, you're not going to get serious disease, hospitalization, and death. So again, we really encourage everyone to get vaccinated and wear a mask for right now. Hospitalizations currently in Mono County are, I'll let Dr. Burrows really speak to that, but I think we are in a safe place for the moment. However, keep in mind the way the pattern goes. First, you see the cases, then you see the hospitalizations, then you see the mortality. And, we do have Mono County residents that are hospitalized.
Yeah, I think it's fair to say we got pretty lucky, or we took advantage of the fact that we were at altitude for whatever that gave us a benefit for with the first go round. And what they saw in Southern California and a lot of the other country, which translated into hospitals being completely overwhelmed with intensive care unit beds being totally full, creating COVID wards literally in parking lots, or creating tent structures to take care of all these people, we didn't see. I feel like that's better lucky than good. And I don't know that we can count on that necessarily again. I think we need to take all the steps we can possibly take to make sure that happens. And for anyone that's listening, I desperately want to be wrong about this. I want to take the precautions and then have it turn out that this didn't happen. We didn't see this massive translation in the cases in the hospital and people dying in the streets and everything else that we're worried about. And if you want to hate me for raising the alarm and saying this could be a disaster, I'm willing to live with your hate as long as it doesn't actually happen. But this is a real thing we're looking at right now. And we talked about this earlier in a meeting we had this morning. And to me, this feels very much like a tsunami. And everything looks terrific right up until your entire city is flooded with ocean water that is 30 feet high all through the city. Nobody wants to get there. So we need to do what we can to make sure that we are as protected as we can be going into this so that doesn't happen. And as Brian said, and I said before, and I'm going to say again, being vaccinated and wearing a mask are our best defenses against this becoming just completely out of control and we don't know what to do with ourselves.
Thank you, Dr. Burrows.
I'm going to jump, Brian, to this next slide if you want to just talk a little bit about the transmissible,
Yeah.
the R0 value and what this kind of means for our community.
Right. So this is the R0. What the R0 really is just how transmissible the virus is, how many people an infected person will transmit this virus to. So the wild virus, or the original virus that came out of Wuhan, you would give it to about 2.4 to 2.6 people. And then we moved to the European wave, and that was about 3 people. With Alta, it's been 4 to 5. And now Delta is 5 to 8 or 9, depending on which resource you're looking at. So it puts it up there. It's more transmissible than chickenpox, the common cold, the flu, Ebola, and it's up there with measles and mumps. So it is one of the most transmissible viruses known to man currently. And unfortunately, we are seeing that right now. It just how cases are doubling and tripling over a few days. So we are in a scary situation. This is affecting businesses. There are multiple businesses that can't operate right now because their employees are all quarantined or isolated because they've tested positive or been exposed. So again, please get vaccinated, wear a mask. It's your best protection. It's the best way to protect the community. It's the best way to protect our local economy and stay open.
Thanks, Brian. So that leads us into essentially the face mask order that will go into effect tomorrow, August 6th, and will remain in effect until rescinded. And that will be based on 3 consecutive weeks of an adjusted case rate of below 6.9 per 100,000 people. And as Emily kind of stated, we're up into the 14s and the 15s. So we really want to work hard to, as we said, get ourselves vaccinated and wear our masks to get us below 6.9. So this means that all persons within the county and the town, regardless of their vaccination status, must wear a face covering while indoor in public settings, venues, gatherings, and businesses. And you can see the many examples. So that would be the town offices, the county offices, retail, restaurants, theaters, our family entertainment centers, meetings, essentially anywhere where you're indoors around the public, not members of your immediate household. And you can see here, there is also a recommendation that all persons wear face coverings while attending large outdoor public events.
Stu, if I can quick chime in on that. You know, this weekend we have a big event going on with Palooza, and it does have the potential to become a mega spreading event. So please, if you're going to Palooza, please wear a mask, please.
There are some exemptions, and you can see here, I don't need to kind of run through that list, but essentially I think these have been pretty consistent throughout the last several months. You can see here persons younger than 2, medical conditions, who are hearing impaired, and then, you know, for those persons who wearing a mask would create a risk to a person related to their work. So again, those exemptions are listed in the order. Just want to remind our many businesses that are listening in, if you haven't or you need to, grab an updated business mask flyer. You can grab those from the COVID-19 portal under the business tab. You can see they're on the right. Just look for that graphic icon. And these are downloadable PDFs, print them, put them up again. I know you probably took them down just a few months ago, but we need to put those back up again, and that will be starting tomorrow. Let's just jump into the vaccine dashboard. Again, these numbers change daily. You can see here that throughout the county, we've vaccinated, you can see almost 70% of our residents. And you can see here we're at 75% of 1 dose. Brian, I don't know if you wanted to jump in there again, but I'll kind of walk through the clinic schedule in a couple of slides, but that's kind of where we're at with our vaccinations.
Yeah, we are above the state average and doing quite well, but you know, there's still about 2,000 to 3,000 people we really need to reach out to and get vaccinated. And I encourage anyone who's unvaccinated to show up tomorrow to our clinic in Mammoth and get vaccinated. It's so important.
Thank you. So here we are. There's the clinic that Brian referenced. That is tomorrow at the Mammoth High School, and that is from 2 to 4 p.m. If you're up in Bridgeport, you can join the clinic on the 27th, and that'll be the Bridgeport Memorial Hall, and again in Mammoth Lakes up in the village. And just some information there on what to do on the day of your vaccination. And again, Brian and Jennifer and his team have Pfizer, Moderna, and Johnson & Johnson vaccines available. And this is for ages 12 and older. Vaccination clinics continue through the month of September and October and November. This is kind of on the schedule right now. If you want to look at any more of these clinics, please go ahead and join us on the COVID-19 portal. That's the county site. Just click on the vaccination tab. All this information and more is available for you to view. We've talked a lot about testing. So we want to encourage everybody to get tested. And again, OptumServe are testing at the Mammoth Lakes Foundation, and that will be through the week of, I think their last testing day will be Saturday, August 14th. And again, they test every Tuesday, Wednesday, Friday, and Saturday from 11 a.m. to 7 p.m. You can see here, beginning on that Tuesday, August 17th, testing will be offered back at the community center, and that's at 1000 Forest Trail. Mono County is also offering free testing throughout the county and the town of Mammoth Lakes. This schedule is every Wednesday from 12 to 2. And you can see those Wednesdays are the 11th, 18th, 25th, and September 1st. And that is from 12 to 2, as we mentioned. And again, all this information is available on the COVID portal. If you're in Mammoth Lakes and want to get tested, you can head over every Monday and Thursday to the new Mono County Civic Center. If you haven't been here, that's a little map from just Google I just grabbed. You can see there, they're just off Tavern Road, next to the police station, right off Sarah Park Road, Tavern Road. And that's Monday, 10:30 to 12:30, and then Thursday from 2 to 4 p.m. Both PCR and antigen tests will be offered. Again, that's all free and open to the public, regardless of insurance. With that, I would like to welcome Dr. Jennifer Wildman, our superintendent from the Mammoth Unified School District. Dr. Wildman, if you're with us and you wanted to just provide an update for our many parents on the call with 4 students coming into school in the not too distant future.
Well, I am masked because there is someone in my room and I was actually exposed yesterday. So I'm practicing. I hope that works for everybody. But we're very, very happy to be announcing that we're expecting to open normally. However, in light of our current health conditions, we'll be talking about all of the precautions that we'll be putting in place for students as we open up in just a few weeks. Some of those things, our kids will be coming to school, will be all masked due to the mask mandates. That was in our plans before the recent, kind of explosion of cases. But we'll be working on keeping students from congregating as much as possible. We'll still be doing health checks in the mornings. We'll still be, making sure that our staff is practicing as much distancing as possible. So masks will be required indoors, not outdoors at this point, although again, we're going to be meeting next week and talking a little bit more about that. I think that some of the biggest changes we might see from a normal school year will include that we won't be having some of our bigger school meetings. So we had a back to school night planned. We'll probably keep that virtual. We're going to, again, ask visitors to avoid coming to school and entering the school if possible, because there's such a variety of vaccination statuses in our families, and there's no real way for us to check whether someone's been vaccinated before they come into school. We're going to ask visitors to please avoid coming if possible. And I think the best news, again, that we have is that we're able to open and we're able to come back, and that we have such a great relationship with public health. And so I feel like we have kind of all of our bases covered when it comes to developing, policies that will help our students and staff stay safe. At this time, until the California Health Department declares a vaccination requirement for school personnel or students, I won't be doing that for our schools, but we're certainly encouraging all of our students and staff to get vaccinated. We're providing as many opportunities as we can for that. And obviously we've seen, that really makes a difference. Masking and vaccinating have been our biggest prevention efforts that have really helped our kids and staff. So, we've already had staff with COVID that are vaccinated, and so they're not working right now. So I guess, we're fortunate they're vaccinated, therefore they're not being hospitalized, but we know that they've been sick. And so we're expecting to have to quarantine students and staff if we do have an outbreak. And I'm saying all this, Brian, before we meet on next week on Monday, we're meeting again, but we know we have to be careful. And so we're just putting as many things into place as we can, and so excited to see the kids. We've missed them. And also just providing our teachers and our students with the alternative, if we do quarantine, of trying to keep them online while they're quarantined. And we'll see how that goes. You know, we have a lack of substitutes. And so if we quarantine, we're hoping to keep everybody learning online. And that was certainly possible last year, and we're hoping to do that again. So I'd be happy to answer any questions anybody has.
Thank you, Dr. Wildman. And as always, anybody listening would like to ask Dr. Wildman a question, please just pop it in the chat. Again, all this information and more is available on our COVID portal. You can see here the URL, website addresses to both the English and the Spanish site. We update our Facebook page on the Mono County Health Department page, and you can always email us at covid19help@mono.ca.gov. And with that, Brian, I'm going to hand it back to you, and we'll start to answer probably the many questions we have in our chat box. So thank you.
All right, thank you, Stu, and thank you everyone on the panel. I do want to introduce everyone we have on the panel because we do have some new faces. Everyone knows Stu already, Stu Brown. Myself, I'm the Public Health Director. We have Bob Lawton, who's the CAO of Mono County. We have my Deputy Director of COVID Operations, Jen Burrows. We have our EOC Commander, Chief McCrassick. We have my amazing epidemiologist with numbers who is able to keep those numbers in my head, Emily Janoff. Thank you, Emily. We have the Chief Medical Officer from Mammoth Hospital, Dr. Craig Burrows. We have Jennifer Wildman, who's the Superintendent for Mono County, or for Mammoth School District. We have Dan Holler, who is the Town Manager. We have Sheriff Braun, who is, well, our sheriff. And then we have our translators as well. So thank you very much all for being here. Greatly appreciated. Why don't we go ahead and open up to questions.
What is the county willing to do to protect county residents over waiting on the state, which is not inclined to do anything due to politics?
Yeah, we've already taken steps. The state has not mandated a mask mandate where we've made that decision to be more restrictive than the state at this point because it is necessary. And, you know, these are steps we did not take lightly. We had vivid discussions around them before we came to this decision, but I'm confident in that decision that we made and I stand behind it. And I think everyone on this panel does too. Would anyone like to add to that?
Brian, if I may, we have followed up until now a strategy through public health of not getting ahead of the state. But I think as the questioner posed, the state is not moving forward at the current time, whether that's a public health judgment or a judgment incorporating some other factors. I can't say, but our concern first and foremost is for the health of our neighbors, of our coworkers, of our visitors, and so yeah, we are out in front of the state, not for the sake of being in front of the state, but we're out in front of the state because of our public health assessment of this situation and the dangers to our residents, vaccinated and unvaccinated alike. Thank you, Brian.
Dr. Burrows?
Yeah, so a couple of comments. One, LA County mandated masking, and a lot of our visitors come from LA County. So like it or not, a lot of our exposure is going to come from people that are here. And if a lot of those people are coming from a county where they're already mandating it, it doesn't really seem that unreasonable to follow suit and mandate it as well. And then again, vaccination is your best protection against getting severely ill, hospitalized, or dying. And wearing a mask is your best protection against transmitting this to other people and then spreading this throughout the community, which unfortunately is also going to translate into people getting positive, getting symptomatic, getting hospitalized, and dying.
Thank you, Dr. Burrows. Emily, can you give us an estimate of how many visitors have tested positive in the last couple months?
Yeah, I mean, probably, we're probably looking around 40 now. I mean, 14 of the 28 positives yesterday were out of county addresses. Before that, it's like everything else. It started slow and now we're seeing a spike. But I would guess the past 2 months or so, probably 40-ish would be my guess.
All right, thank you, Emily. And to be clear, those positives that are visitors are not reflected in our numbers.
Correct.
Okay, why don't we take the next question?
What percentage of the positive cases are vaccinated versus unvaccinated?
Emily.
So as of recently, a lot of the batch that we got in today, which I still haven't gotten to some of, but from what I saw, we were at 67% of those were in fully vaccinated individuals. Again, those numbers there's a lot of factors that go into that. These are recent current outbreaks that are going on. It's not great, but we should keep in mind, we've vaccinated over 8,000 people in this county. So 33 breakthrough cases is a very small portion of that. And 99% of what we're seeing end up in the hospital and severe cases are still happening in unvaccinated individuals.
Thank you so much, Emily. Next question, please.
Is there a reason Blues-a-Palooza is still taking place in these alarming circumstances? Should we not be canceling or limiting capacity?
Dan Holler, can you address that?
Yes, thank you. We've actually had that discussion. The main challenge right now is tonight was the first night for Blues-a-Palooza, just as we're hitting all these cases. So there are, literally, numbers of people in town with prepaid tickets. So to cancel it and do or even begin limiting capacity on that, you'll be dealing with people who have already paid for their tickets to be here and to be able to go to the event. What we are looking to do, and we've already got agreement from the organizers that will have public health presence as we have staffing available at the event.
Did I freeze?
Oh, yeah, what's that? Yeah, you'll have people there. So anyway, as they're available, but we're also driving. They will be giving out masks for people to wear. We'll be re-emphasizing with them to make that more than just a suggestion, if you will, to try to require it where they're not eating or drinking at the time. If they can have their mask on, especially if you're sitting and listening to music, put your mask on. To the extent that they have some social distancing standards out there in the open, to be able to encourage that as well. So we'll do that follow up to it. I mean, all this stuff hit us right at the same time. Everybody was coming in for the event. And I could say a lot of it was prepaid, et cetera, to do a close out of the event at this point in time would be extremely disruptive to the community, obviously to the event, the producers, and to the people coming for the event. So it'd be a difficult decision at this point that we drive that home, and we hopefully will have a good cooperation in terms of the mask wearing.
Thank you, Dan. Deputy Director Burrows, can you tell us what public health will be doing at Blues-a-Palooza?
I can. So we will be at Blues-a-Palooza on Saturday, which happens to be one of their busier days, from 10 to 2. And we will be providing testing and vaccines for anyone who asks. If we see a huge surge of people who want to come to the tent to be tested or vaccinated, we will extend our hours if necessary.
Jennifer, will we be distributing masks at all?
We will have masks at our table. Sean from Blues-a-Palooza will also be distributing masks at the front gate. So they will be requesting their volunteers that everyone continue to wear a mask at Blues-a-Palooza. In addition, the beers, when they are served, will not be poured from the spout. They will be poured from a pitcher. in hopes to decrease any contact with other people.
Thank you so much. Next question, please.
How will you be monitoring and enforcing the mask mandate with all the folks in town for Palooza?
Sheriff Braun? Well, you seem to be muted.
Sorry, doubly muted because I didn't think you all wanted to listen to the Olympics in the background. I had my phone and the Zoom muted. My apologies. Palooza is outdoors. So although masks are recommended for outdoors, they're not required. There wouldn't be any enforcement aspect for that. For other aspects of enforcement, it's going to be the same as it was for the past year and a half. We're not looking for people to rat each other out. We're not looking to, enforce the mask mandate. We're asking people to comply. We're working on the education component. And what we will enforce is when you are a jerk about it, when you refuse to leave a business and then you get arrested for trespassing, or you start yelling and screaming, then you get arrested for disturbing the peace. Or if you decide to go hands-on with somebody because they didn't like your not wearing a mask, then you get arrested for the battery. We're going to go for the violations of the penal code, which are much more serious, to get your attention, to make sure that you understand how this works. But for the most part, people need to take personal responsibility and wear a mask when they're in a situation where they need to wear a mask. And if you're in a situation where masks are required and you don't want one, then remove yourself from that situation. Or you're in a situation where you see someone not wearing a mask and it makes you uncomfortable, then remove yourself from that situation. Take personal responsibility, take care of yourself, put yourself and your family first, and make sure that you do the right thing. And if somebody is really out of line, then call us and let us know. Same for Mono Sheriffs or the police department or Highway Patrol or anything, and we will come out and we will handle it.
Thank you so much, Sheriff Braun. Let's go ahead and take our next question.
If a business still has a plastic shield up for face-to-face, do they still need to wear a mask behind the shield? All staff are vaccinated.
Yes. Next question.
Is closing short-term rentals a consideration?
Not at this time. At this point, this is, as far as we're going with restrictions, is just asking to please wear a mask.
How do I know which virus I have?
Well, I assume we're speaking about a variant. So variants are identified by genome sequencing, which is a very specific test. And maybe Emily, you could explain it better than me. Go ahead.
Sure. Yeah. It's when Delta was first starting to make its way into the US, we were focusing on trying to get cases, especially breakthrough cases, sequenced, but it's unfortunately not something that a regular PCR test will tell you. It needs to be collected, it needs to be stored at different temperatures and shipped differently, and it goes off to a different lab. And then it's about a 2 to 3 week turnaround, and that's based on having enough specimen collected. There's not a great, easy process at this point, unfortunately, but especially if it's a breakthrough case, you should probably just default to assuming it's the Delta variant. I think Brian, you can correct me, but I think over 80% of the cases in the state now, or 80% of what they are sequencing in labs, are coming back as Delta. So we know it's the dominant strain. And unfortunately, it doesn't really change anything about your protocol for isolation or anything like that.
Actually, I think what I heard today is it's 93% across the country. So yeah, change. Go ahead, Dr. Burrows.
I was just going to add, in simplest terms, if you get infected, you can assume it's Delta virus at this point.
Yeah.
That's without having to dive into statistics or analysis. That's just the reality of what we're facing right now.
Thank you, Dr. Burrows. Let's go to our next question.
Any news on fall sports through school?
So the state keeps saying that it's coming out very soon. It was supposed to come out, I believe, Jen, today. It was supposed to come out yesterday, but then today, we've yet to see it. So hopefully soon. Jen, you were in on a meeting yesterday where they talked about it, correct?
Correct. They're down to two options. One would be to follow the K through 12 masking mandate, in which that you would have to wear a mask indoor for any indoor sports. The other one is a modified version of that, and they really have not decided at this time.
So more news to come, hopefully soon. Next question, please.
Masks are recommended for large gathering/event. What is considered large? And if requested, could public health assist with making rapid tests available at an event?
So, it's kind of an abstract consideration what a large event is. What's large to one person is not large to another, but certainly where we have events where there are mixing of households, I would consider that a large and potentially dangerous event. Dr. Burrows, do you have anything you want to add to that analysis?
Yeah, based on what we looked at before, we talked about limiting to 3 families or less than 12 people. So whether you agree with it or not, as far as like Brian was saying, large or small, I think anything over 12 with more than 3 families involved would be considered a large event. And again, I think you have to consider the effect of what happens when that many people get together. If one person can infect upwards of 8 or 9 people, it's like the commercials you say, well, you tell one person, they tell someone, and so on and so on. Before you know it, you have spread it to hundreds, if not thousands of people without even realizing it. That's how contagious this is. So I would probably agree that you want to keep gatherings small and probably less than 3 families, and at all costs try to associate or be involved with people that are at least vaccinated. And if you're symptomatic, please don't go, whatever it is. You are only putting everyone that you're in contact with at risk. This is one of the lessons that I'd like to think that we've learned from this. And it's remarkable how fast we decide that that's not important anymore. And we just go on with our daily business. And, this is the difficulty with, or the argument of saying, well, I don't need to wear a mask, I'm vaccinated. It's like, well, you do need to wear a mask because it's that contagious. And if you're symptomatic and you're symptomatic with this virus, specifically the Delta virus, you can give it to other people.
Yeah. Thank you, Dr. Burrows. And as far as the public health question, I'm getting to you, Jen. Just one thing to consider with that rapid antigen test is that it is really designed for symptomatic individuals, because when you're symptomatic, you have a much higher level of virus, and that's what it's detecting, that higher level. So, if you're going to an event or you want to be sure that an event is safe, I would recommend having people do a PCR test maybe 72 hours or less before the event. But go ahead, Jen. I know you had your hand up.
I was just going to echo what you're saying, that unless you're symptomatic, those rapid tests will not come back positive. At Palooza, we will be offering PCRs and rapid antigens, and at our public health testings, we are offering PCR and rapids. In fact, we're pretty much doing both on everyone who walks into the public health testing sites. Now, just to clarify, OptumServe is still just doing PCRs at this time. So public health in Mammoth is doing testings Mondays and Thursdays, in which we will be doing both. But again, unless you're symptomatic, the rapid antigen test is not going to give you conclusive results.
Thank you, Jen. I do see we have a person with their hand up. That's an attendee. Should we go to that individual?
Sure. Dinah, would you like to unmute yourself?
You can go ahead and unmute yourself. Okay, we'll come back around. There seem to be some technical issues there. Let's go to another question in the chat box.
In regards to having events indoors, events are fine as long as both parties, audience and performer, are masked up or fully vaxxed. Or should events indoors be postponed until further notice?
No, events indoors are allowed to continue, but everyone needs to be masked, just as the order says.
Is there a possible date of when children under 12 will be able to get vaccinated?
Go ahead, Jen. Jen? There
Sorry.
you go.
We are hearing word that September it's coming. They have not given us an exact date, but it's supposed to be, Pfizer is supposed to be fully approved for everyone, kids included, in September. And let me just add to that. When that does happen, we will be ramping up vaccination clinics so that everyone can bring their kids in, or whoever has waited to get for the vaccine to be fully approved, that they can come in and get vaccinated.
All right, thank you very much, Jen. Let's go to our next question.
What percentage of Mono County is under the age of 12?
Oof. Superintendent Wildman, do you happen to know that statistic?
Let's see, we have 1,200 students. And in our elementary, we have around 550. So we don't have all of the students, obviously, in the county, but
Right.
and I would say there are probably about 150 in Eastern Sierra. So if I was to make a guess, I'd say about 800 kids under 12, but between 5 and 12. I don't have the under 5. I can't tell you that. So maybe 15%. Just a guess.
All right, thank you, Jennifer. Let's go to our next question.
What about enforcement in places like Vons or other indoor areas where visitors especially walk in without masks, or where employees have masks below their nose? What does enforcement look like there?
I'll go to Ingrid first, and then maybe Dan would want to chime in as well.
So enforcement looks the same as it looked all last year. We had visitors nonstop. COVID didn't stop people from coming to the county, and we had people who behaved and people who didn't. So it starts with education and reminding people, hey, you forgot your mask, or cover your nose, that sort of thing. I will tell you, my experience at Vons is that the employees, even the employees that I used to see with the mask below their nose, are wearing their masks. I went in the other day and we're not required to wear masks yet, so I didn't. And I was one of maybe 5% of the people in the store that didn't have a mask on. People are being pretty good. Most of our visitors are coming from the LA area where they are required to wear masks indoors, and that's normal for them. So it hasn't, in my eyes, it hasn't been an issue. And that was a day when the line was down through the wine and beer aisle, very crowded at Vons, and most of wore masked up.
Thank you, Sheriff. Go ahead, Dan.
Yeah, I would just echo that. We are really relying on the businesses, again, to step up in those areas. Again, not to get into a confrontation with people. If they do, then they need to call out to the sheriff or police department, the 911 call, let people know what's going on. But I would say I had the same experience this morning in Vons, where the majority of people in there had their mask on and had them wearing them correctly already. So I think people are used to that. We will definitely have some folks who will forget or who won't, put one on, et cetera. But we're really hoping that the vast majority of people, which I believe they will, and they have in the past, will step up, wear a mask, wear it appropriately, and be respectful of the other individuals that they're around, either their own family or visitors, locals, friends, et cetera, that they will treat them with respect and wear the mask appropriately.
Thank you, Dan. We have about 6 minutes left, and it looks like we only have a few questions, a couple questions left in the Q&A. So let's go ahead and get to those.
The June Lake Jam Fest is scheduled for September 10th through 12th. We are anticipating 500 attendees. It seems that you would have recommended that Palooza not happen in light of the current surge. At what point should other events like June Lake Jam Fest be postponed?
Yeah, I think we will, continue to monitor the situation, take a look at our numbers. and make our decisions based upon that. It is just too early to decide about an event in September.
Can you confirm that you do not need to be symptomatic to be contagious? Asymptomatic vaccinated people who are positive can still spread the virus. Is that true?
Just as much as an unvaccinated individual, yes, 5 to 9 people you can transmit it to. Next question.
That's all the questions we have in Q&A, and I don't have any hands raised at this time.
Is there any comments that anyone on the panelists would like to make before we close out?
I know everyone wants to think that this is over. Everyone's tired of it. We've been dealing with it for well over a year and a half. This is a real threat right now, and the rules changed, and nobody wants that to happen. But if the rules change and you don't adapt, you're going to lose, and that's what we're looking at. And it's just that plain and simple. Get vaccinated, wear a mask, pay attention, respect how potentially dangerous the situation is, and we'll get through it just like we got through it with the first rush of this that's gone on forever. Getting fatigued and tired of this situation is not an excuse to ignore it and let it just run rampant all over us again.
Thank you, Dr. Burrows. Dan?
Yeah, I was going to pretty much echo that. I think, a year and a half ago or a year ago, had we seen the numbers that we're seeing right now, we would be in a much more significant lockdown in terms of activity in our community. The elements we believe that are in the benefit to us here, we're definitely seeing increases in cases. We're definitely seeing people be ill. To the extent that we have the vaccination going, and again, as everybody has said, we're encouraging people to be vaccinated. The impact of the disease is still less on the individual in terms of how sick they get, which is a good thing. We still don't know the long-term ramifications of having COVID. Getting sick with anything is generally not enjoyable. Don't recommend it for anybody. But the idea there being just because of that, the spreading of it, the impact of it is still unknown. And we are very concerned about our youth in terms of what happens, especially for those under 12. And then also, again, the people that are impacted heavily by this is often our frontline workers. And as they're sick, as they're positive, as we go in and work with businesses, it's not so much that we're closing down a business, is the business will not have employees to be open. And the pressure that puts on other employees and or on the business is just not good for our community either. To the extent that we can be responsible, we can be healthy by just practicing those basic things. It's get tested, wear a mask, wash your hands frequently, be cautious of distancing when you're in a big group and you don't know the people there, they're not your own family. Just those basic steps that we've been pushing on for the last 18 months are still just as valid now as they were then. The disease is definitely seemed to be spreading faster through our community, impacting people. As mentioned, we do have at least one person in the hospital. But the impact it has on you may not be felt as much, but we don't know the long-term implications of that. And again, having to quarantine, having to miss work is again just hard on everybody. So please, just begging people to take up a point of responsibility, wear a face covering, wash your hands, watch out for distancing, be careful where you're hanging out at. Thank you.
Thank you, Dan. Stu, there was a question in the box about our cadence for these meetings. Do we plan to continue to have these on a weekly basis again?
Unknown at this time, Brian. I think we'll discuss that at future meetings, and we'll certainly post updates to the COVID portal. So I just would encourage everybody to visit that COVID portal. It is now getting more frequently updated, and I'm sure we'll have that information on that site when we schedule kind of our schedule of meetings. So
thank you, Stu.
You bet.
Thank you very much. Thank you to all the panelists. Thank you to everyone who's attended. Please mask, vaccinate, take care of yourselves, and take care of each other. Good night, Mono County.